cardiovascular examination يعني بيجيكم الامتحانات انه examine the heart. فانت first of all في inspection يعني you inspect certain things that are relevant to the heart. في مثلا شغلات palpation you palpate مثلا pulses okay. You inspect the chest بشكل عام, things that might be cardiac related, scars بالchest, bulges, masses جوا chest, gynecomastia, scars. Then you proceed with the cardiovascular examination للheart. You examine the heart مثلا by palpation, you palpate certain things, then percussion, فيش إشي كثير بالpercussion بالheart. Then you do auscultation. Okay, palpation كمان you palpate for many things. رح نجيهم بالتفصيل. إنما يعني before before I enter into the cardiovascular examination كنت حاب هيك عندي سلايدز حلوة هون حاب أورجيكم إياها سلايدز. مثلا this is clubbing. okay, أنتوا سنة رابعة alright. فيعني شفت السلايد هذا حبيت أورجيكم إياها. clubbing. فclubbing it's something you need to know. It's very important. okay. And the clubbing, the angle between the nail and the nail bed is kind of more than 180. okay, أكثر من 180. عادة الانجل بتكون less. alright. there are certain diseases في أمراض تؤدي to clubbing. okay, so when you examine the nails you look for the nail and the angle between the nail and the nail bed. so clubbing مهمة جدا هيك بتطلعوا عليها. okay, and there is of course زي ما حكينا certain diseases منها كاتبين هنا تحت causes. okay, cystic fibrosis, cyanotic heart disease, okay, bronchiectasis. But there are certain diseases that will cause clubbing. مهمة جدا clubbing. حبيت أورجيكم إياها بس. okay, before we start. 38 people, very good. all right. 38 people admit all. excellent. فمن راح عليه clubbing, this is clubbing. all right. read about clubbing, how you know it, how you diagnose it, and what are the causes of that. It's very important clinical. just last كم أسبوع أجاني مريضة endocarditis, واحدة عمرها 50 and she had clubbing. endocarditis, it's one of the causes in subacute endocarditis. all right. الآن صار عندنا 40 مشترك. الإديمة عارفين شو الإديمة وأسبابها. okay, cardiovascular examination. يعني one session I don't think is enough, so most likely 32 sessions, so we can continue. one session راح يكون general. I think السيشن الثاني most likely راح يكون أركز على المurmurs. okay, auscultation. all right. مهمة جدا خاصة انكم انتوا الكلينيكال تاتش شوي بعدكم فيها delayed because of what's happening بالكورونا. فكويس واحد يركز على cardiovascular examination. when you examine cardiovascular يعني there's something about pulse, pressure, GVP and inspection. رقم 4 هاي inspection. الكل سامع، لو واحد مش سامع بحكي معي ها بس الكلكم سامعينها. admit أيوة everybody. okay. the inspection, when you inspect the pericardium يعني you will be asked in the examination to examine the pericardium, but go and examine general, look for the shape of the chest, bony spines, trachea if you can see the trachea, if you see any visible pericardial bulge and visible pulses sometimes. Okay, scars رقم F high, scars, dilated veins. Okay, حتى the hair distribution in the chest is important. Gynecomastia in males, these are important things when you inspect. Okay, inspect means you look to the chest and you look from the feet of the patient عند رجليه, so you can see central. Okay, مش نص side by inspection. When you examine by palpation, you stand on the right side of the patient. By inspection, you go into عند رجلين المريض الفيت, so you can inspect and symmetrical شوف the chest if there's bulging. Okay, all right. And the palpation هون زي ما حكينا رح نجيها. You palpate for the apical beat, you palpate for the في ناس نحاول ندخلهم. All right. You palpate for the apical beat, for the heave and the thrills. Okay, مهمات المصطلحات هذول. Apical beat, thrills and heave. Okay. فأنا بحاول أدخل اللي أجوا هسه. All right. The percussion number 6 بالcardiovascular there is no percussion. You percate هاي ما بالcardiovascular ما في. Then number 7 auscultation. Auscultation مهم جدا. بجي نعطيكم سيشن كامل عليه على murmurs. Okay. All right. Let's go. Pulse. Pulses. All right. You feel the pulse. Okay. احنا most likely بالradial pulse. في عندنا البريكيال pulse, في عندنا الكاروتيد pulse, في عندنا الفيمورال pulse. Okay, and in the pulse when you palpate يعني شو what you are looking for. You are looking for the rate. So when you feel the pulse, number 1, well, heart rate والله 70. Okay, so the rate important. And the rhythm, شو يعني الرhythm? Rate and rhythm. شو الرhythm? Regularity. Okay, and the pulse is regular or irregular. irregular. فإذا قال لك البulse irregular يعني بتفكر بأتريال fibrillation مثلا. إذا قال لك rapid pulse fast and it's regular, then you think about مثلا SVTs, atrial flutter, ventricular tachycardia. There's certain things. Okay, so the rate, the rhythm. هل هو منتظم؟ لا. الفوليوم, if you can feel the volume that'd be nice. The volume means قديش ضغط البلس اذا كانت high volume او small volume. مثلا واحد عنده dehydration والبلد pressure is low والبلد volume is small, then you feel the pulse very very tiny small. تقول والله small volume pulse. تشوفها بالكاردياك شوك مثلا, واحد عنده شوك كاردياك شوك او هيموريجيك شوك بنزف, تلاقي البلس عنده very small والتاكيكارديا. اوكي, فهذا هم انا كويس تعرفوا من ريت ريدم فوليوم. otherwise في other things مثلا في واحد يسموه radio femoral delay. when you feel the femoral مثلا radial pulse والfemoral pulse and you feel the radial pulse يعني a lot earlier than the femoral pulse, you see delay بيسموه. you might see it in diseases cell coarctation. Okay, coarctation of the aorta, maybe you're gonna have a delayed pulse. Okay. All right. There is طبعا pulse. All right. Rate. And I want you to concentrate on how to do it here in this picture, how to feel the pulse. Okay. بأصابعك, fingers. All right. 2 or 3 fingers. That's the way you do the radial pulse. Okay. The brachial pulse, we'll see it later on. That's how you feel the pulse with fingers. The rate from 60 to 100. If below 60, that's bradycardia. More than 100 is tachycardia, and there's causes for this and causes for that. Okay. We will concentrate into more in the clinical things. Okay. Causes of signs bradycardia, causes of signs tachycardia, mental causes. All right. واحد عنده مثلا hypothyroidism, myxedema, برادي صح؟ براديكارديا, hypoxemia والتكي. يعني واحد عنده مثلا fever, hypovolemia, pain, septic shock, etc. fast. All right. الرhythm okay the rhythm it's regular or not regular okay you might feel something called sinus arrhythmia in something young patient with high vagal tone الرhythm بيكون منتظم شوي غير منتظم هاي بتكون بسموها sinus arrhythmia which is normal thing okay بس اذا كان grossly abnormal زي البي هون الريجولار بتفكروا لي بالاتريال fibrillation okay AFib that's the main thing كثر الله خيركم atrial fibrillation it's the main thing that will cause irregular and it's the most common actually all right the pulse volume إذا إنه you can feel it that be fine but that's additional thing all right زيادة هاي يعني again the pulse volume has small volume large volume مثلا large volume بيكون البلس قوي جدا large volume بنشوفها بالcases of aortic regurg AR الاورتيك ريجيرج طبعا الكرونيك حتى الكرونيك يعني مش جديد الكرونيك اي اي هذول كلهم بسموها ووتر هامر بلس الى اسم حتى اوكي هاي زياده ويعني الكاركتر مش مهمين هون ليش اوكي مثلا في ديزيز زي الاورتيك ستينوسيس اي اس الاورتيك فالف بيكون ستينوتيك سمول بالتالي من the blood goes from the left ventricle to the aorta بيكون الدم stroke volume is really bit small, but you might feel something called like small narrow pulse. Okay. Some of pulsus tarvus, parvus et tardus. يعني صغيرة الحجم الفوليوم delayed. Okay, delayed peak. Some of parvus et tardus. هاي بالaortic stenosis. يعني هاي زيادة. يعني بيعطيكم بس example شو معنا ايوه
في طلاب عم تستنى اذا في مجال تفوتهم
ايوه دخلناهم alright
Thank you
alright good okay اذا البلس احنا بلشنا بالاكزامينيشن you take the pulse of the patient read the pulse rate rhythm if you want to know the volume it would be nice the volume of the pulse زي ما حكينا why we do that if the volume is really small volume you think the patient is maybe hypotensive hypovolemic common sense صح منطق وعنده bleeding cardiac shock okay والريجولار اذا كانت tachycardia or bradycardia الريت يعني but then that's a pulse what you are looking for the pulse the rate the rhythm the volume all right large volume زي ما حكينا بالاورتيك ريجيرج okay هون في other causes mitral regurg VSD يعني there are certain diseases will give you certain volume of the pulse هاي بيعطيك الفكرة مش شرط تبصموهم الآن إنما when you feel the pulse the rate the rhythm the volume why because the volume could change according to the disease okay في certain diseases will give you high volume certain diseases will give you low volume all right يعني راح تسمعوا بالمصطلحات في المستقبل water hammer pulse collapsing pulse mainly that's characteristic of aortic regurg and that's the way it looks all right وفي اسم يسموه pulsus persiferians all right pulsus alternans يعني واحدة بتحس البulse sometimes big sometimes small sometimes big pulse sometimes small pulse okay it could be one of the cause of يعني heart failure أو إذا كان pericardial effusion sometimes pericardial effusion بيكون pulsus alternans او حتى بالاي سي جي بسموه electrical alternance بيكون QRS complex voltage مره كبير مره صغير that's بالpericardial effusion اوكي والهارت فيلر بعطينا pulsus alternance مضبوط pulsus bigeminus pulsus paradoxicus راح تسمعوا فيها اللي هي mainly لما يكون tamponade pericardial effusion and the severe pressure on the heart okay and there's the ways how to measure it إذا البلسز في لها عالم أشكال وألوان أوكي والبلس ديفيسيت أوكي يعني أنا ما مش I don't mean إنك تحفظوهم هذول but I mean you just have an idea that you feel the pulse and you want there are certain things you look for the rate the rhythm the volume all right and there is certain types of pulses okay زي ما حكينا في شيء اسمه radio femoral delay means you feel the radial artery in the left hand شوفون حاسه بالleft hand بالرايت حاصل femoral, okay, and there is delay. You feel the radial pulse and then later on the femoral pulse. Usually you feel them almost together. And if you do that, means there's obstruction in the aorta, and that's coarctation. Okay, this is very important picture. Okay, and how to feel the pulses. Okay, بالfingers you feel the زي ما حكينا الراديال pulse متذكرينها بالايدين وبالرجلين بالفingers. اوكي، الراديال pulse بالفingers والدورساليس بيدس بورسيرال تيبيال برضه بالفingers. البريكيال هون الثumb. اوكي، نفس الشيء بالثumb الكاروتيد. اوكي، كاروتيد بريكيال بالثumb بالايدين وبالرجلين بالفingers لانه احسن شيء بتحس فيهم هون. تمام. This is the best way you can feel it. All right. blood pressure ما بدناش نحكي عن الضغط. اوكي، في ناس waiting، خلينا كمان ندخلهم. right. ضيعنا السلايدز شوية، نرجع السلايدز. وين السلايدز؟ اوكي، رجعنا للسلايدز. كل شايف السلايدز مظبوط؟ البريشر بنفس نحكي عنه. اوكي، بس يعني الكويس تعرف النورمال بلاد بريشر لازم يكون below 130. اوكي، normal pressure 120 over 80. It should be below 130 over 80. If it's above 130 then it's kind of elevated. Above 140 you should treat. Okay, blood pressure. Okay, the GVP pressure, jugular venous pressure, من الأمور very important to know it. And when you examine the patient to see if there's hypervolemia, heart failure, the GVP. And the way you measure the GVP, هسه عم نجي في صورة هون, jugular venous pressure. Okay, the patient will be in 45 angle. Okay, and there's a sternal angle here, and you see the jugular pressure pulse بتشوفه هيك هنا. You put يعني تقريبا you do it visual, بس هنا that's the way you do it. Okay, يعني ما بكون معك مساطر انت، انما visually you can do it. And if you want to measure this way you can. تمام. فهون بتقيس how much of the vertical length مثلا 3 سم 3 centimeters, and then you add 5. Okay, usually below the sternal angle there's 5 centimeter pressure. Okay, then anything above it here 3 بصير 8. اوكي، فرضنا هون كان جي في بي عالي جدا وكان هون 7 plus 4 plus 5 12. That's be high. It means the patient is hypervolemic and he's in heart failure. So the GVP is important thing to measure, an indicative of hypervolemia, an increase in the right atrial pressure, okay, and the volume, and that's a sign of failure, heart failure. Okay, all right. طبعا له ويفز وما ويفز وعالم اخر هذا ما بنحكي عنه. يعني انا عندي سلايدز كثيره و a lot of details بس مش مهم. السنه رابعه ماشي لكم هذا الحكي. ان later on راح تشوفوا هيك شغلات، خاصه اذا واحد يعني he went into medicine او cardiology, then you know these things in details. Okay, بس كسنه رابعه I'm gonna choose for you things you need to know Okay. All right. So when you inspect the chest, لحد الآن ما جيناش بالexamination طبعا. You inspect the chest, you inspect the shape of the chest. Okay. Normal مثلا versus barrel chest. Barrel chest means increase the anteroposterior diameter. Anteroposterior diameter بيكون chest barrel بسموه. When you see that in certain diseases, they see OPD. Okay. Chronic obstructive pulmonary disease اللي بدخنوا. COPD بيكون hyper inflated chest and the chest is نافخ. فإذا بصير عندنا AP diameter is increased and called barrel chest. Okay. تسمع باسمه pectus excavatum. Pectus, that's by inspection of course. Pectus excavatum means you see the chest and the chest, the sternum is depressed inside. Okay. That's how it looks.
دكتور بعد إذنك في طلاب بدهم يفوتوا إذا في مجال.
أيوة هي دخلناهم. صار عندنا 58 people. Very nice. Excellent. فإذا pectus carinatum, pectus excavatum, barrel chest, pigeon chest, pigeon يعني زي الحمام, pigeon chest. فكل هذول you inspect the chest and they are associated with certain diseases. It's called sternum displaced anteriorly. Okay. Anteriorly, that's increased AP diameter. All right. So inspection مهم جدا. انت when you examine the patient, you inspect, you palpate, you percuss, and you auscultate. Okay. This is the four things. بالهارت زي ما حكينا percussion مش موجود كثير. اذا بدك تعمل بصير. Yeah. اسمع مش مهم. All right. Before you start this examination, you take the pulses, the pressure. Okay. And then you examine the chest in general. So when you inspect for the shape of the chest. Is it normal chest, barrel chest, pectus excavatum, pectus carinatum? Okay, it's important. And when you inspect also, you might see the epical pulse. You might see the carotid pulse. Sometimes you see it, the carotid is pulsating. Sometimes it can be seen. بتقول visible epical pulsation, visible carotid pulsation. You might see that by inspection. Visible epigastric pulsation. You might see hepatic pulsation and the liver pulsation. You might see sometimes. Okay. All right. نرجع للpalpation. مهمة جدا هاي palpation and معظمكم بخربطوا فيها how to do it. All right. It's really simple. Yeah, this is the picture. So you use the tip of the fingers to feel the pulsation. You feel the base of the fingers to feel for the thrill, and you feel the base of the hand here for the heave. Okay. Pulsation, thrills, and heave. Okay. الثريل يعني هي a kind of grade 4 murmur بسموها أو thrill. بيكون البلد when you feel the heart going fast between high يعني two chambers and going very from high pressure to low pressure. بتحس في thrill هيك تحت إيدك. All right. اللي عندهم AV shunts بيعملوا dialysis بتحس دائما thrill عندهم. Okay. Thrill. But that's the way how you do it. بالbase of the hand here heave, the base of the finger thrill, بالfingers the pulses. Okay.
دكتور في طلاب بالله دخلهم لو سمحت.
Yeah. المشكلة إنه بيعطلونا هون وبخلوا أوكي نرجع. أوكي وين الطلاب؟ أوكي هون. All right. 63. All right. ظبطت. Okay. Very important thing here انه the apical pulse and the apical beat دائما انتم بنسالكم عنها بتخربطوا فيها بالهارت examination. اوكي بالهارت على الليفت سايد طبعا. ففي عندك انت mid clavicle line هون هاي الاسترنم مثلا. اوكي فالميد clavicle line حوالي سنتيمتر ميديال بالفيفث interspace. fifth interspace mid clavicle line little bit 1 centimeter medial on that's the normal people where you feel the apical beat. اوكي وتقريبا apical beat بتكون 2.5 سنتيمتر سكوير. اوكي يعني مش كبيره هيك. if more than that بيسموها diffuse apical beat. smaller than that بيسموها tapping apical beat. اوكي all right. This is very important for you how to examine for the apical pulse. دائما بسألكم عنها. So you put the patient is sleeping. بتحس you count for the spaces second, third, fourth, fifth. Mid-clavicle line. Okay. Mid-clavicle line. Fifth interspace. You feel with the fingers. Okay. That's the apical beat location. And then, of course, when you feel the apical beat, why you want to feel it? First, you want to know where is it. Now, if it's normal, if it's really big, if the apical beat is big, that means the heart is enlarged. صح? And if it's sustained when you feel it and it push you and sustained, that means there's left ventricular hypertrophy. That's why it's important. Well, diffused means enlargement, and the cause of a level of LV enlargement is mitral regurg, VSD, aortic regurg, ischemic heart disease, dilated cardiomyopathy. So when the apical beat is big, then you know there's certain diseases can cause large apical beat. If the apical beat is sustained, then you know there's causes for that. Left ventricular hypertrophy, aortic stenosis, coarctation of the aorta. Okay? All right? But that's why we examine it. So because there are certain diseases will cause that. Okay. Choose the apical beat. All right. معنا 10 minutes بخلص السيشن وفي سيشن ثاني بكمل لكم. All right. على 11. The patient is sitting this way. That's the way you palpate. Okay. So the palpation, apical beat, thrills, heaves. Okay. Masses. طبعا بتعمل بشكل عام بالبداية for masses, pain, tenderness in the chest. Okay, crepitus, okay? Then you palpate for the heart, for the apical beat and the thrills and the thrills. Heave, apical pulse. 3 شغلات. Okay, for this, you localize the apical beat, mid-clavicle line, little bit medial, this is sternum, fifth interspace, all right? Now, if you can't, if the patient is obese, you might tilt him to the left. Okay? Left rotation. So you can feel it better. إذا كان مريض ناصح بالآخر أو عنده COPD sometimes. اللي عنده COPD راح تكون difficult لأنه barrel chest, inflated chest, then the apex might be inside, then you might not feel it. Sometimes you don't feel it if the patient is so obese. Okay? So left lateral position, you might do that. So you can feel the apical beat. This is a maneuver. You can do it to feel the apical beat better, okay? And then you analyze the apical beat, as we said earlier. What are the apical beat? Is it like normal? It's heaving, okay? What will cause the apical heave? يعني hypertension, aortic stenosis, coarctation, hyperdynamic apex برضه. إذا كان عنده heart failure, aortic regurg, mitral regurg, there are certain diseases will cause hyperdynamic apical beat, okay? All right. مش مهمة. All right. Okay. Thrills. Okay. So apical beat, thrill, heave. الثريل that's the way you feel the thrill is going to base of the fingers, okay? So you feel in the aortic area, pulmonary area, tricuspid area, and the mitral area. You feel for thrills, okay? And you feel thrill means there's like a murmur, but it's like grade 4, 5, 6. And there's high pressure chamber. There's a shunt between mitral regurg, aortic regurgitation, high pressure to low pressure blood flow. Okay, so that's how we feel the thrill. For aortic thrill, AS, AR, pulmonary, PS, pulmonary stenosis. Okay, and the left lower sternum boundary, VSD, left sternum boundary بيكون عندنا مثلا زي VSD, you can feel thrill. Okay, بالاpex, mitral stenosis mainly. Mitral regurg, MS طبعا it's very famous mitral stenosis to cause a thrill in the apex. MS, condiastolic thrill mainly. Okay. All right. auscultation, إذا inspection, palpation, and you palpate for the apical beat, for the thrill, for a heave. اوكي الهيف طبعا المفروض جابوا لنا صوره على الهيف. الهيف you base of the hand او حتى side of the hand, you put it in the right parasternal area, and the left lower parasternum for right ventricular heave. And the right ventricular heave means the right ventricle is hypertrophied, and that indicate pulmonary hypertension, pulmonary stenosis. Okay, any cause زي tetralogy of Fallot. يعني مثلا بالyoung people you might see in the left parasternal heave in a young patient, cyanotic patient, they think the right ventricle is hypertrophied, and you think TOF, tetralogy of Fallot. Okay, anything with old people, مثلا pulmonary hypertension, pulmonary stenosis, the right side will be hypertrophied, and the way you feel it, the left sternum boundary, you feel a heave. Okay, the right ventricle is really pushing your hand. Okay, so that's the heave. But apex, if you feel a heave in the apex, left apex indicative of left ventricle, they mean the left ventricle is hypertrophied. زي ما حكينا في aortic stenosis, في عندنا coarctation, severe pulmonary hypertension. All this will cause LVH, left ventricular hypertrophy, and you might detect that by feeling a heave in the apical area. Okay. Auscultation. Auscultation, you in the stethoscope, there's diaphragm and bell. Okay, diaphragm and bell usually use both, and the bell is used for low pitch sounds. Okay, يعني مرة احنا الساوند كان عالي نسمع بالdiaphragm، بينما الساوند كان really low pitch يا دوب تسمعه then you بتحرك للبell. Okay, it will detect low pitch sound. Auscultation, you auscultate aortic area, pulmonary area, tricuspid area, as well apical area. Okay. All right. الآن إذا انتهى السيشن بنبلش بالسيشن الثاني. أبى أكمل مع كل الأوسكالتيشن مهم جدا. اوكي when you auscultate
دكتور نقدر نبلش السيشن الثاني على مباشرة بعد هذا انه مش على 11.
اوكي بصير هو انا حاط على 11 ان شاء الله الكمبيوتر يسمح لي. اذا سمح لي بخلي ابكر شويه. alright. فاذا when you auscultate in the stethoscope, first for the sound, عندك sound, the heart sound, tick 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 tick, heart sound, first sound, the second sound. طبعا احنا we hear the sound and then we want to know the murmurs. الساوند طبعا في لهم عالم من يعني normal sound, loud S1 مثلا, faint sound مثلا, split S1, split S2. شو معناها وكل واحدة وكل anything you feel يعني you hear it might indicate certain diseases. فمثلا هون S1 الS1 انتوا عارفين S1 is closure of the aortic, closure of the mitral and the mitral and tricuspid valves. S1, okay, when the heart is beating, Okay, and then the mitral and the tricuspid valve will close. So closure of these valves will cause S1. Okay, S2 when the heart relax. When the heart relax, then the aortic valve will close and the pulmonary valve will close. Okay, usually the aortic valve is faster than the pulmonary. So بتلاقي مثلا S2 هاي ممكن A2 P2 A2 هو الأورطة P2 هو الpulmonary closure. Usually بيكون الأورطة faster. But there are certain diseases where there'll be split, means the pulmonary will close later on. So the A2 will come a lot earlier than P2, زي مثلا pulmonary hypertension. Okay, فبسموها wide split S2 مثلا أو fixed split S2 بالASD مثلا. So في عنا S1 و S2. alright, عرفنا شو هم. Okay, إذا كان عندنا ال S1 which is closure of the mitral and the tricuspid valve. إذا كانوا في عندنا mitral regurg أو tricuspid regurg صمامنا نسكر يعني في regurg بيكون soft ال S1. أوكي مش loud. فإذا مثلا تسمع والله بقول لك soft S1 what are the causes؟ MRTR مثلا يقول loud S1 MSTS مثلا they can cause loud S1. فإذا S1 which is the closure of the mitral and tricuspid valve which is the first sound. It could be loud, it could be low, it could be normal. Okay, so if there's soft, there's causes. If it's loud, there is causes as well. Okay. But then when we hear the sound S1, S2, مش بس we hear them, we want to know the character they are now normal or not. And if they are not normal, and we want to get to guess what are the causes. All right. But S1 هذا في أسباب. It could be split, it could be reverse split. كمان زيد الطين بل الآن. It could be reverse split. Okay, and there's causes for each one. Okay. Okay. S2 مثلا. S2 which is closure of the aortic and pulmonary valves. It could be soft. It could be loud, and there's causes. It could be single as well. Yeah. S2 which is closure of the aortic and the pulmonary valves. But a split S2 يبعث الايميل على تكست. ببعث لكم سلايد.
انا ببعث لك اياه خلص.
ببعث لكم سلايد انا وتقراوا مع مهلكم لانه في سلايد اللي فيهم هذول فيهم كثير سلايدز حوالي 100 والرابعه انتم بدكم جزء منهم فقط. يعني عندي سلايدات كثيره مش لكم يعني اتس ريلي ادفانس شويه ديتيلز كثيره يعني ما فما بدكم اياها. انما انا اخترت لكم الشغلات البسيطه وانتم اقراوا مع كيفكم. مرات انتم وانت ريد مور ديتيلز بتفهم الموضوع احسن.
خلص بعثت لك الايميل دكتور على الشات.
اوكي بس اخلص ببعث لكم السلايدز وزعوا محلكم. اوكي يعني هذول سلايدز نايس وفيهم ديتيلز وفيهم كل شيء عن الكارديوفاسكولار يعني تو ماتش حتى يعني nobody will use all this information. انما انا بدي اياك تعرف البيزكس how to inspect how to palpate. Okay, and you palpate for what? For the apical beat, location, character of the apical beat. Okay, and thrills as well heave and auscultation. أهم شيء auscultation بالموضوع. How to use the stethoscope and what you are listening for. And when you hear something, you want to know what is it. يعني أنت بالنهاية you want to know what's this and to help you to know the disease. المريض شو المرض. Okay, and then you treat the patient, and that's what you want at the end of the day. You want to know المرض and then how to fix it. These are the tools which we use to treat the patients. Okay, صار عندنا 41. again يعني انا بدي احكي انه مش مطلوب تحفظهم كلهم هذول it's difficult. انما basic things okay you know there is sound, there's S1 S2 what the mean S1, S2, and if it's loud, if it's soft, there's certain diseases, of course. All right, split S1, split S2. All right, مثلا S2 إذا كانت loud you think of hypertension مثلا. إذا كانت loud P2 طبعا هاي صعبة جدا to know in S2 مثلا is it the A component or the P component which is loud. طبعا ال P component بيكون على pulmonary area بيكون loud pulmonary hypertension مثلا. اوكي split S2 مثلا تيجي بالامتحانات دائما عندكم الامتحانات انه fixed split S2 S1 وهي S2 اوكي S1 S2 S1 S2 ف S2 كل اثنين لهم split ف S2 على normal when you breathe inspiration this S2 will split more. That's normal. Okay, so the P2 will be even later because when you breathe there's more blood going to the right side of the heart, more blood going to the pulmonary area, and the pulmonary closure will be a little bit later. Okay, so when you breathe, okay, so the respiratory, when you breathe, it will make the split change sometimes. Okay, for one disease that the S2 split will be fixed. They call it fixed S2. So when you breathe, the S2 split will not change. That's called ASD, atrial septal defect. In ASD, when there's a shunt between the atria, so the respiration will not transmit into change in the split. It will be fixed. So بتسمعوا دائما لما بتقرأوا fixed split S2, that's التشخيص بيكون ASD, atrial septal defect. اوكي
دكتور افضل اللي
عملت
استنى.
عملتها
تمام
يعني بستنى كل ما يجوا اثنين ثلاث بعملهم مع بعض. اوكي alright. ف يعني انه مش هذا الحكي كثير طبعا معلومات زي ما حكيت بس انتم knowledge. اوكي S3 S4 هاي كويس الامور بدي اياك تعرفوها. مثلا S3 if there's S1 S2 the S3 means heart failure in on older people. Okay, S3 S1 S2 then you meet hear a third sound auscultation sometime which is a rapid gush of blood into the left ventricle or right ventricle sometimes, and S3 it's indicative of heart failure in young people. Okay, all right, and if the rate is more than 100 so you hear something called S3 gallop. See زي الحصان يركض زي ركض الحصان ترت that's S3 gallop. It's اللي بيجي بالبلمري إديما وهارت فيلر بهالليل تسمع صوته ترت the S3 gallop. That's heart failure. Okay, you might hear S4 sound. S4 it is the contraction of the left the atrium against a high stiff ventricle. They call S4. S4 indicative of stiffness of the left ventricle and indicative of what we call diastolic dysfunction. And in older people, it's very common. In young people, should not happen. Okay, S3 can happen in young people, but not in old. If in old, it means it's a pathology. S4 it can happen in older people as a normal age-related, but in young people should not in kids. Okay. اوكي فالاس 3 when you hear it يعني شو والله ما هي التشخيص يعني اس 3 هارت فيلر زي ما حكينا. اوكي هارت كاردياك اوتبوت ستاتس. اوكي يعني it's mainly heart failure. هاي بتحفظوا في other differential diagnosis of S3 زي pericardial knock. اوكي pericardial knock بالconstrictive pericarditis. اوكي في شيء بسموه tumor probe بالميكزوما بعطي S3. بس انا انتم طلاب رابعه احفظوا لي بس heart failure done nothing more. If you hear S3 in an older man it's indicative of heart failure. S3 زي ما حكينا it's indicative of stiffness of the left ventricle the atrial contraction against stiff left ventricle. Okay, and that's got S4. And you might see hypertrophic cardiomyopathy, systolic hypertension, left ventricular hypertrophy, any cause of LVH it will cause stiffness of the left ventricle, so the atrium will, when it contract, يطلع sound S4. Okay, very common in older people with hypertension. Okay, راح تسمعوا شغلات opening snap. It's one of the things when you auscultate in mitral stenosis. Okay, MS. And the opening snap.
دكتور في ناس على الويتنج بعد اذنك.
اوكي. انا لو بعرف احط واحد منكم هوست يعملها احسن، كو هوست، بس هون رايت خلينا نشيل هاي. اوكي.
حطني انا دكتور اذا بدك.
انا مش عارف كيف اعملها.
اوكي.
مره عملناها مره واحده ونسيت كيف اعملها. اوكي خلاص. هيدا
من المشاركين اظن بتكبس على الاسم،
بس على اسم اي واحد خلاص.
بتكبس على اسم المشارك بيطلع لك خيارات بتحط أيوة. منها ميك از هوست.
طيب هسه نعملها. نعمل مراد اسماعيل طلع قدامي. هاي مراد اسماعيل، كبسنا على اسمه بيطلع لي خيارات. مراد اسك ستارت فيديو ميوت ميك. اوكي مراد عملنا كو هوست خلص زبطت. اذا انه موجود صحيح.
تمام انا هيني موجود.
هاي عملنا كو هوست، معه صار عندي 51 ومكان 65، يعني ممكن يجي كمان ناس زياده. فالاوبننج سناب يعني انا ما بدي تحفظوها الاوبننج سناب، انما it's one of the signs by auscultation for MS mitral stenosis. okay, and opening snap being the mitral valve بالdiastole بيفتح الميترال valve بالdiastole صح؟ بيجي relaxation of the heart, so diastole comes and the mitral valve will open. The MS mitral stenosis, the mitral valve is stenotic and fibrotic. تمام. بالروماتيك فيفر هذا طبعا. الروماتيك فلما يفتح الميترال فالف اوكي it suddenly بيمسك هيك suddenly it will stop because it's fibrotic. The sudden stop of the mitral valve it will cause snap. Okay, so that's my MS. There's opening snap. You hear it opening snap. فبيجي S2 بعد S2 بيطلع كأنه صوت صغير، هذا بيكون الاوبننج سناب. alright. And you will hear something called ejection click مثلا بالpulmonary stenosis بالaortic stenosis خاصة congenital بالyoung people you might hear some called click persistently. Okay. Pericardial knock, it's one of the things that you hear in constrictive pericarditis. يكون pericardium is calcified. Okay. And you might hear a sound حقيقة بعد S2 يعني it will زي ما حكيت it could be يعني mixed confused with S3 فكرة S3 it's pericardial knock. alright. هاي زيادة مناش يعني مش أنا بيحكي في S1 S2 okay and the murmurs, that's it, simple. Friction rub is a sign of pericarditis. Okay, because the pericardium is inflamed وبكون بحكوا هيك على بعضهم parietal visceral pericardium فبصير sound that's pericardial friction rub. It's pericarditis. When you have friction rub زي البيبر when you تلعب بالبيبر هيك الورقة تطلع خشخشة that's friction rub. Okay, it's a sign of pericarditis. بدناش نعقدها. friction rub كمان له stages، له systolic ودايستوليك وcontinuous والى اخره. فالمهم friction rub. alright. trauma blob بعطينا الساوند المurmurs. اوكي هل بدي اياك تعرفوه the murmurs. okay what left with time. المurmur بالstethoscope when you put it in the heart and the aortic area, pulmonary area, tricuspid area and apical area. 4 areas. Okay, 4 areas. And when you hear a murmur you want to know the timing of the murmur. Okay, timing of the murmur is it systolic or diastolic? Systolic or diastolic? Systolic or diastolic يعني S1 بعد S1 or بعد S2. Systolic, so the timing is crucial. And number 2, the high intensity location. Where is the location of the in the heart where you hear the maximal intensity? So you hear a murmur maximal intensity على aortic area معناته aortic valve disease. إذا على pulmonary area معناته pulmonary valve disease. إذا على tricuspid area معناته tricuspid valve disease, etc. Okay. فإذا timing and the maximum intensity location. So بنعمل sometimes grading للميرمر, grade 1 2 3 4 5 6. اوكي alright. فاهم شيء التايمينج, لانه اذا ما عرفت التايمينج اوف ذا ميرمر مش راح تعرف شو هو الميرمر, مش راح تعرف شو المرض. اوكي سهلين يعني, it needs a little bit practice, it's really easy. اوكي يعني في certain things about the murmur, يعني want to see the number 7 هون مثلا, او number 8 او number 9 اللي هي variation of the murmur with inspiration. بيزيد بالinspiration ولا بقل بالinspiration؟ والله بالinspiration بيزيدوا right sided murmurs. اوكي when you take a breathe كل right sided murmurs بيزيدوا, the tricuspid regurg. اوكي بيزيد pulmonary مثلا stenosis, pulmonary regurg بيصير loud. اوكي بالاكسبريشن مثلا left side murmur بيزيدوا. اوكي that's what it means. وسامتايم بالبوشر وقفت المريض او قعد المريض الميرمرز ممكن يزيدوا او يقلوا. والمثال على ذاك hypertrophic cardiomyopathy, هاي كثير الpositional things will change the murmur. اوكي فهاي كويس تعرفوها اللي هي الميرمر and the grading of the murmur. If grade 1 very soft, grade 1 soft يعني ما بتشرح تسمعه عادة. So يعني grade 1 you cannot hear it, so soft you need a very quiet room to hear it. okay that's grade 1. فإذا شفت حالك مش سامعه قول grade 1, يعني تقريبا يا دوب سامعه, إذا في حركة وصوت ما بنسمع. grade 2 you hear it and soft. grade 3 you hear it very nicely. okay يعني بتصير تسمع الميرمر very very nice without a thrill, so that's grade 3. okay معظم الميرمرز 2 or 3. 4 grade 4 بيكون murmur very loud, and when you palpate before even you auscultate, you will palpate, you felt there's a thrill. okay when the thrill in addition to loud murmur, that's grade 4. okay 5 بيكون thrill و really very loud. okay 6 مش مهم, بيقولوا انه you can hear it without stethoscope. alright that's number. المهم معظم الميرمرز 2 or 3. إذا في thrill بيكون grade 4. okay so these are the systolic murmur. Diastolic murmur يعني مش مهم diastolic murmur, المهم systolic murmurs, and that's the gradings. okay so the murmur, where is it located, timing, systolic or diastolic, and where is located the maximum intensity and the grade. okay سهلين هذول, وهذا هم أهم شيء بالموضوع اللي هو the timing of the murmur. okay so they have S1 and this is P2 هون, S2 هون طبعا. S2 it's divided into A2 and P2. A2 which is the aortic closure and the P2 is the pulmonary valve closure. okay so this S1 which is closure of the mitral and the tricuspid. so if we hear early systolic murmur, it means after S1 immediately you hear shh, shh. Yeah, with S1 shh, shh. That's early systolic murmur. And should amrad, what are the diseases will cause early systolic murmur? VSD, tricuspid regurg, mitral regurg, but acutely. okay acutely means يعني واحد عنده MI and he had acute MR mitral regurg يعني acute, then it'll be early. يعني early systolic murmur. okay بالchronic MR بيكون long systolic murmur, بيكون كل systolic. alright فإذا early systolic murmur, and there's like some diseases like that. but إنما أنا into you want to how to recognize it clinically. when you hear it, well, is it early systolic, it is really long systolic, it's really mid to late systolic. okay it could be diastolic murmur, diastolic after S2. but now we are talking about early systolic murmur. And the timing is important because when you know it's in systole, so you know the disease. With diastole, for other diseases. okay if you don't know the timing, then you don't know the disease. okay certain things called ejection systolic murmur. Ejection systolic murmur means the murmur will start from S1 here. It starts kind of faint and then increase in the intensity, then it decreases. Crescendo decrescendo. okay that's aortic stenosis, AS. Okay, or it could be pulmonary stenosis as well. Okay, AS or PS. AS على aortic area بتحضر, you hear maximum intensity. PS على pulmonary area, the maximum intensity. Okay, so that's called ejection systolic murmur, and it can go all through systole, all through systole, مش بس early systole. Ejection systolic murmur. Now, if you go late systolic murmur, يعني هي S1, this is S2. Okay, S1, S2. Now, if it's mid to late systole, or late systole, before diastole, before S2, that's called هون الأمراض يعني mitral valve prolapse or tricuspid valve prolapse. Okay, يعني mitral valve will close, and systolic close, open, diastolic close, open, close. So the mitral valve will close, okay, and the pressure in the left ventricle will be high. Later on, the mitral valve will prolapse later on. When the pressure in systole increase, gradual increase, then the mitral valve will prolapse to the left atrium. When it prolapse, then you hear shh murmur, okay? The blood will go back to the left atrium from the left ventricle. So systole, and then late systole, the valve will prolapse, and then the blood will go into the left atrium. You hear the shh. S1, later on shh, this murmur. That's mid to late systole, mitral valve prolapse, tricuspid valve prolapse. Okay? فإذا it's a message to you that there's systolic murmurs, diastolic murmurs. Even systolic murmurs, there's early systolic murmurs, late systolic murmurs, long systolic murmur, وكل واحدة لها certain diseases. Okay? That's why when you know it, you can know the disease when you auscultate. All right? It will be difficult earlier, but شوي بس it's easy. All right. Paransystolic murmur. So that's the systolic murmur here from S1 to S2, and it's all through the. So paransystolic means even you don't hear the sound. مش tick 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 S1 S2. يعني long systolic murmur, you hear the S1, you hear S2, and you hear the murmur. Tick tick long systolic. This is long, this pan-systolic murmur that you don't hear even the sound. The murmur is covering everything. So that's why they call it pan, P-A-N, pan, all. Okay, so pan-systolic, there's no sound. Long systolic, S1, S2, and there's all through systole, there's a murmur. So pan-systolic murmur, MR, TR, chronic MR, chronic TR, BSD, يعني chronic. بيكون كله ميرمرش. طبعا الماتر you hear the maximum intensity in the apical area radiate to the axilla. Okay, so you tell the patient in the left lateral side. So MR, pan-systolic murmur or long systolic murmur, apical area radiate to the axilla. Okay, TR in the left sternum boundary. Okay, left sternum boundary, that's a TR. Okay. Okay, so very nice. Then timing important, maximum intensity important. The timing, so you know it. The maximum intensity, you know, it is the 3R or the MR, etc. Okay. All right. شو ضل عندنا هون؟ هون مش مهم اخش بالديفرنشال لل other things. Early diastole. نيجي على الدياستولي. All right. الدياستولي early diastolic murmur. هاي هون على الليفت هون. هاي S1 خلصنا منه. هاي systolic phase on diastolic phase, which is the systolic diastole. Diastolic phase, which is the filling phase, the relaxation phase of the heart, it's filling. Okay, so the phase where the pulmonary and the aorta will close, and then the mitral will open. Okay, and the opening of the valve, you will not hear it usually. You hear the sound at the closure of the valves. Okay, closure of the valves. That's what you hear. So for early diastolic murmur, usually aortic regurg, pulmonary regurg. Closure of the aorta pulmonary, and then there's a murmur after that. بعد S2 S1 S2 S1 S2 صح؟ بعد S2 is murmur. Okay, it means when the aortic valve closed, let's say, then the blood come back from the aorta to the left ventricle, that regurg. Okay, so after closure. والpulmonary نفس الشيء. على الpulmonary area بتسمع انه بعد S2 there's murmur. والpulmonary regurg usually is really faint, يعني it's difficult to hear with younger people. With tetralogy of Fallot very common. Severe pulmonary hypertension. Aortic regurg is more common, very very common. Okay. And then early diastolic murmur after S2. Okay, could be AR or PR. Mid diastolic murmur. بالدايستولي الآن mid diastolic murmur. الفيموس هو mitral stenosis MS. But this is S2 يعني اللي هو A2P2 في opening snap زي ما حكينا يعني the valve is snapping and there's a mid diastolic rumble بيسموه mid diastolic rumble أو mid diastolic murmur. أوكي بالدايستولي يعني مش early الميد. هذا usually in the epical area radiate to the axilla بتسمع mid diastolic rumble that's AS. حقيقة S1 بيكون loud S1. فالMS loud S1 opening snap mid diastolic rumble هم الثلاثي المرح تابعين mitral stenosis on auscultation. الليت diastolic murmur يعني the same هون the mid اللي هو الMS TS أو مكزوما. اوكي هاي مهمة. الكونتينوس ميمر شو يعني continuous murmur؟ يعني ميمر بتسمعه بالسيستولي والدايستولي تسمعه بالسيستولي والدايستولي all systole and all that يعني it's really machinery murmur or continuous murmur and that's PDA patens ductus arteriosus. Okay, patens ductus arteriosus, it means there's blood vessel connection between the aorta and the pulmonary. Okay, and the aorta pressure is always higher aortic pressure than the pulmonary area. Okay, than the pulmonary pressure. فبيكون عندنا السيستوليك والدايستوليك murmur. Okay, but that's continuous murmur. If that one continuous murmur, you think of PDA. Okay, patent ductus arteriosus. الآن وأنت تقرأوا فيه بيجيكوا names of the murmurs يعني مش مطلوب تحفظوها إنما راح تمر عليكم شغلات أوستن فلينت murmur جراهام ستين murmur etc. يعني هسه مش مهمين هذول. إنما there are certain murmurs لهم names. كاريكومس murmur. alright. وmany times إحنا murmurs يعني later on شو تعرفوا إنه you might make the murmur more loud by certain maneuvers. Okay, يعني you might take inspiration, expiration, valsalva maneuver, standing or sitting. There's a certain situation where you can make the murmur louder. مثال example hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy, if the patient stands, the murmur will be really loud. Okay, when the patient sits, the murmur will be soft. Okay, when the patient breathes, the murmur will be also loud. All right, but this is called maneuvers where you can augment or make the murmur more obvious. Okay, standing or sitting, valsalva maneuver. Okay, and to see the relation between the murmur and the respiratory variation. يعني هاي زيادة البيان. كان سنة رابعة مش مطلوب منكم الحكي هذا standing و squatting. But there are certain things you can do to make the murmur. يعني هون أمثلة عليها hypertrophic cardiomyopathy. تمام. If you stand مثلا it will be loud hypertrophic cardiomyopathy. If you sit it will be softer وهكذا. Just let you know about this. All right. في أسئلة? Any questions? فأنا راح أبعث لكم سلايد على كلن.
خلص تمام دكتور، أنا بعثت لك إيميلي على الشات هيو موجود.
Okay. ابعث لكم سلايدز وتسلوا فيهم ان شاء الله. وجود لك. ثانك يو.
يعطيك العافيه دكتور.
شكرا.